some pretty decent legislation being introduced this 2020 regular session, both in the Washington State Senate in this example, and at least a couple of things in the House. So this bill in the Senate was introduced or written by Senator Hasegawa, and then these are the rest of the co-sponsors: Kader, Lilius, Lovelit, Guillen, Stanford, and Wilson. Introduced her first read 114, so just a couple weeks ago, and again it's Senate Bill 5204. If you live in Washington State and feel so inclined, I would highly recommend you to contact your local state senator. My case, that's Senator Mona Doss. So I sent her I commented on the bill, and it gets sent to her, expressing my opinion that this really should be passed. Let's make sure Washington State is on the right side of history on this issue. The issue being more or less universal health care, making sure everybody in the state has access to health care. So, being able to go see a doctor, that type of thing, as well as dental and vision. One thing I haven't seen in this bill that I would like to see would be access to health care, because that is a huge part of a person's overall health. Also includes prescription drug benefits. So we'll read a little bit. So again, if you live in Washington State, contact your senators, urge them to support this, and if they're not, ask them why they don't want everybody in our state to have access to high-quality health care. Point blank. If you're not in support of this, that's what they're telling you. So, an act relating to healthcare financing and development of the whole Washington Health Trust to ensure all Washington residents can enroll in nonprofit health insurance coverage, providing an essential set of health benefits, boom, so healthcare, including medical, dental, vision, and prescription drug benefits, adding new sections to Chapter 8202 RCW and adding new section to Chapter 8232 RCW. That's, Regulatory Code of Washington, something like that. Strawberry, chia, kombucha, so good. Okay, providing contingent expiration dates, universal essential health benefits. So there we go, universal health care. Universal coverage, protecting healthcare choices during this time of uncertainty affecting the future options for thousands of Washingtonians to retain their healthcare coverage and thousands who face high out-of-pocket costs. The people of the state of Washington declare their intention to create a single primary nonprofit health financing entity called the Whole Washington Health Trust. The trust will simplify healthcare financing, eliminate administrative waste for providers, which is a huge reason why Medicare right now is so much cheaper than private insurance. Is because the lack of administrative costs when you do it in a not-for-profit way. I mean, just think about if you have private health insurance, you gotta call your provider. Hey, I need to get this done. Is this in my network? Does this cover this? You need people, at all of these for-profit health insurance companies and pharmaceutical places to have a lot more staff and overhead in order just to make sure to see if they can deny as much coverage as they can. That is their job. You obviously wouldn't have that in a universal healthcare system. Focus savings by promoting a healthcare delivery system that is responsive to the essential health needs of each county and guarantee all residents may enroll for coverage of a single comprehensive set of essential health benefits as a basic human need that is essential for productive society without the burden of current high premiums, deductibles, or without modest exceptions, co-payments. Modest exceptions. I think the co-payment should be done away with completely, so that is one area I'd also like to see this bill get a little better. I mean, it's like literally like $5 or less. I mean, it should be free at the point of service if it's truly universal. So I'm going to even say $5. It needs to be free at the point of service. All residents of the state of Washington are eligible for coverage through this chapter. Individuals enrolled for essential health benefits under this chapter may obtain health services from any participating institution. Look at that. So any institution that would be enrolled in this, and obviously, it would probably be for their benefit to enroll, because this is going to be a huge, massive amount of people potentially signing up for this. I would fucking sign up for it. It'd be great. May obtain health services from any participating institution, agency, or individual qualified to provide the service, including participating providers outside the state. Look at that. Nothing in this chapter limits a resident's right to obtain coverage for healthcare benefits in excess of those available under the trust. So it's not outlining private insurance or anything like that. You could always get coverage in addition to this, but you would automatically be able to enroll into this program no matter what, which is amazing. No person shall, on the basis of sex, national origin, age, disability, or sex, including sex stereotyping, gender identity, sexual orientation, and pregnancy and related medical conditions, be excluded from participation in, be denied the benefits. So some anti-discrimination aspects of it, which is obviously important. Yeah. So, I mean, pretty damn decent. Nothing in this chapter limits providers' right to receive payments from sources other than this trust. So, I mean, again, they're just giving people the option to enroll in a universal healthcare program that would cover, again, health, dental, vision, and access to prescription drugs. I do wish it included a provision for accessing mental health care. That is one way I think it could be improved. So pretty decent bill. Again, Senate Bill 5204 here in Washington State was first read on January 14th. Universal Health Benefits Trust, or Washington State Health Trust. So good. So you live in Washington State, highly recommend you contact your senators about this bill. Urge them to support it. Ask if they do. If they don't, really question why they don't want everybody to have access to high quality medical care in the state. That's the bottom line. Leave your thoughts in the comment section down below on SB 5204 in the Washington State Senate. Peace, much love. Like the video if you like the damn video. Subscribe for more content. Peace, much love.